Hello, guys. Can you hear me? Please, if you can hear me, I need you to type in the comment section, please. If you can hear me, you can just type yes or Y, please. Okay. Let me see how many people we have here. 1, 2, 3. Yes, you can. Okay. Okay. I am fine. I'm fine. Okay. Okay, that's reasonable. Ah, you guys are welcome. Good evening. Sorry, I came back late, so that's why I sent it late. Thank God I'm even here by this time. Okay, yeah, thank you. Yes, I'm using my mic, so I think it should be clear. Nice to have you guys here. There are still some people. This is 27. I have up to 40 people that are supposed to join the class. Where are they? You're welcome. You're welcome. I need everybody to pass their exams properly. And that's why I had to bring out this time for us to, discuss. And it's on YouTube so that it will be recorded and so that there will be no obstruction. So anytime you can always review it, especially before your final exam, and also any external exam you're writing. All right. So today we are going to discuss. It's more of questions. So let me tell you how we are going to do this thing so that it will make sense. I don't want you to get bored or to sleep off. All right. So I will discuss briefly, then I'll start posting questions for you guys to attempt. All right. So each question I post, I'll be expecting up to 20 answers. So you just put in your answer. If it's A, B, C, D, just put in anyone. Right. Then we discuss which one is correct and we move on. So it will help you guys really, to just very similar questions to what you most likely you're going to see in your exams. All right. So I need all of you to make attempts. Even if you don't know the answer, don't get intimidated by your friends that are also very fast. All right. Don't get intimidated. If you don't know the answer, you can just write not sure. All right. Not sure. If you need me to explain something, just write, please, can you explain this? If you have any question to ask, please ask. Please. I need all of you to ask questions if you have any. And if you are, following me, if you understand what I'm saying, just keep moving. All right. But I need everybody to always attempt a question. Everybody. You understand? I don't want a situation whereby it will be just 4 people or 5 people that are attempting questions. No. If you fail it, we will explain, we will give you the right answer. All right. Yeah. So I will share my screen. Give me a minute. I will share a screen. So I will discuss. I'm still trying to get a hands of this stuff. Okay. Windows. Yeah. Which of the chapters is more like? Do you guys find more challenging? Is it the digestive system or the urinary? Do you guys find more challenging? Anyone that is more challenging, we can start with it. You understand? Because I know that by the time we discuss an hour plus, some people will feel sleepy. So I want to start with the one that is more challenging for you. Urinary. Okay. Urinary. Wow. Okay. 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 Urinary. So our problem is urinary system. Okay. Urinary system. Urinary system. All right. Digestion has a lot of information to cover. Of course, he has a whole lot of information. A whole lot of information. Okay, so what we are going to do is that we will start with urinary to make sure that everybody is it's here. I hope you can see my screen. You all can see my screen, correct? Yes. Yes. Okay. Urinary. Okay, perfect. Perfect. So I will be very, very fast with the recap, right? I'll take just 10 minutes. Yeah, with just this recap. And immediately we finish it, I need you all of you to pay very rapt attention. Immediately we finish this recap, we just jump straight into is this urinary system? Yeah, we jump straight into question and answer. All right. I keep telling people, especially for some of you that are preparing for NCLEX, if you are preparing for NCLEX, the more questions you solve, the better for you. Any exam you are preparing, the more questions you solve, the better for you. All right. But it's always good for you to, have the baseline information, which is why, we have lectures in class. This doesn't substitute for it. This is more just like a last minute recap. All right. For you to test how far you've been able to, understand the topic so far. All right. Okay. So if you can see my screen, then we can proceed. Yeah. So I will just focus specifically on the most important informations. We already know the urogenital system. This thing is glitching a little. I don't know why it's glitching. So if you look at this diagram, I need you guys to put it in your head, the position of the two kidneys. All right, the two kidneys. They are not in the same area, and you should know which one is in the lesser part. All right. So if you look at it, this one is superior to this one. This is superior to this one, and this one is inferior, like it went down a little because of the liver. So this should be the right kidney. Like I need you guys to be able to understand this thing by mere looking at it. You should know the functions of the kidney. Extremely important. Now, you should also know about the body's waste products, all right? Like the metabolic waste, urea formation, uric acid formation, and creatinine formation. These are the three major wastes: urea, uric acid, and creatinine. You must know them because you will see equations on them, all right? And also, you need to know what BUN is, which is blood urea nitrogen, and why it's important. You need to know what azotemia is, all right, which is elevation of this BUN. And anybody that has this azotemia, we will automatically conclude that the person has renal insufficiency, because this is a clear indication of renal insufficiency. Now, there's something we call uremia. Uremia is when the person starts vomiting, having diarrhea, dyspnea, cardiac arrhythmia, all right? The only thing you can do for a patient that has gotten to this stage is hemodialysis or organ transplants. You have to change the kidney ASAP, all right? So these are the major nitrogenous waste, which is ammonia, urea, uric acid, and creatinine. They will ask you, one of the following is not a nitrogenous waste or a major nitrogenous waste. You should be able to identify which is a nitrogenous waste and which one is not. All right. Now, these are excretion, like excretory organs, all right, or systems rather. The respiratory system, the integumentary system, the digestive system, and the urinary system. They will ask you which one is not an excretory system. All right. So you need to understand it. I will show you with the equation. Let me see. Yes. Another thing you need to know is the protective coverings of the kidney. The protective coverings of the kidney, the renal fascia, the perirenal fat capsule, and the fibrous capsule. Extremely important that you know this. The renal fascia, the perirenal fat capsule. What do they do? The renal fascia, right, is just a continuation of the parietal peritoneum. It binds the kidney to the posterior abdominal wall, covers it like this in the front and hold it to the posterior abdominal wall. That's why we say that the kidney and most kidney organs, right, are retroperitoneal organs. Extremely important that you know this. It's not intraperitoneal. Intraperitoneal is completely covered, like the stomach. But this one is retroperitoneal. It's just covered in the front and holding it to the posterior abdominal wall. All right. Now we have the perirenal fat. The perirenal fat is just to hold the kidney in place. Extremely important you know this. Then we have the fibrous capsule, which encloses the kidney and protects it from trauma. All right. And also from infection. So these are the three major things. Now, this is a diagram of the kidney. Okay. This is the diagram of the kidney. All right. This is a cadaveric diagram of the kidney. All right. It's very, very important for you to understand what renal cortex is: pyramid, minor calyx, major calyx, renal column, renal artery, renal sinus, and renal vein, renal pelvis, and ureter. These things are important. These informations are very important. You will see it when I start pushing out questions. All right. Now, this, as I mentioned initially in my urinary video, if you cut open the kidney like this, everything inside is known as what? Parenchyma. All right. Just like if you open a cell, everything inside is known as what? Cytoplasm. This is parenchyma. All right. Now, this parenchyma is divided into two parts. This extreme part is known as what? The cortex. And this inside part is known as what? The medulla. And please mind you see this part? This part is the hilum. This area is the hilum. This place I'm pointing now, it's the hilum. That is where the renal pelvis and other structures enter the kidney. Extremely important. That hilum, they ask that question a lot. And I will show you this night, all right? Now, another thing you need to know is that the minor calyces, they open into the papillae. All right. So the papillae enter the minor calyces enter the major calyces enter the renal pelvis, and the renal pelvis enters the ureter. Then the ureter now moves to the urinary bladder. Then when it accumulates, it comes out through the urethra. Please know that. I'm not going to repeat it, sorry. Now, this is a clearer picture of what you should know. So take your time and study this diagram. All right? Because you need this diagram for you to be able to answer most questions. Sorry, I'm running very fast because I want this thing to, I don't want this discussion to exceed 2 hours, please. So, let me see. Okay, now, you see this part is also a part that you need to study very well. This is the heart, all right? All the blood comes from the heart. That is the left part of the heart. Now, blood lives through the biggest artery in the body, which is the aorta. So this is the aorta. The aorta pushes blood to the renal artery. It comes down from the renal artery. This is the renal artery here. From the renal artery, it moves into the segmental artery. From the segmental artery, blood moves into what? The interlobar. From the interlobar, it moves into the arcuate, just like an arc. This is the arcuate. All right. If you can see my mouse, this is the arcuate. Now, the arcuate now leads to what? Cortical radiator. All this one that looks like fire is radiating. Cortical radiator. All right. Extremely important for you to also know this. All right. Now, the cortical radiator now leads into the afferent. Afferent. All right. So the afferent is the one that enters. Very, very important for you to know. Now, when the afferent enters the glomerulus, it transfers the blood. You look at it, you see it. It has changed a little color to some extent. All right. So the efferent moves blood into the glomerulus. Now, when the blood has moved into the glomerulus for some time, it will start filtering. I need you to remove or to differentiate the fluid compartment of the kidney and also the blood movement of the kidney. You need to differentiate the urinary movement and the blood movement. So when all these things we've discussed is blood movement. So when that blood finally enters the glomerulus, right, it will filter. That's the first part of the entire thing, filtration. It will filter the fluid. It will now divide the fluid. So the urinary part and the blood. Blood will continue to the efferent and goes out of the glomerulus. But the urinary part will continue through the tube. So I need you guys to get it. And this division happened in the glomerulus. So in this glomerulus, there should be an arrow pointing downwards. That up arrow is filtration arrow. We will get to that. So, but this time around, we are still talking about the blood. So when the blood has filtered completely in the glomerulus, it moves out through the efferent. E. So afferent, then efferent moves out. From the efferent, it moves out. It moves into the peritubular capillaries, then cortical radiator vein, arcuate vein, interlobar vein, renal vein, and inferior vena cava. Very, very important for you to know this. And if this, the nephron, remember there are two types of nephron. We have the juxtamedullary nephron and the cortical nephron. If we are talking about the juxtamedullary nephron, what happens? The juxtamedullary nephron has something we call vasa recta. All right. This vasa recta is also something else that will carry blood, all right, from the efferent and send it to the cortical radiator. So it's important for you guys to understand this movement. This movement is physiological movement, and I will show you a question on it. You need to understand the two movements. Don't mistake it, all right, with the blood movement, the fluid movement. The fluid movement starts from the glomerulus. It filters and it starts going. All right. Then from there to collecting duct, from collecting duct to papillary duct, from papillary duct to minor calyces, from minor calyces to major calyces, from major calyces to where? To the renal pelvis, from renal pelvis to ureter, ureter to bladder, bladder to urethra. That's the fluid movement. So the fluid movement starts from the glomerulus. But the blood movement starts from where? The aorta or the heart itself. So you need to be able to separate these two things together in your head. for you to answer all the questions in the exam, because this is the basis of urinary system. Trust me. And if you know it now, you know it for life, not just for this exam. Some of you are writing college exams. Some people write NCLEX. You need this information because it is always coming out in your exams. And also you meet it in the clinic a lot. All right? Okay. So let's look for the other important things. So if you look at this diagram, you see, if you look at this diagram, what do you see? You see the microcirculation of the kidney, all right? Microcirculation of the kidney. You see this kidney that is very small here. This is the cortical kidney, cortical nephron rather. This nephron that is here. And this is the juxtamedullary nephron. It's long and it extends into the medulla. But the cortical is more majorly in the cortex. But mind you that all of them ends up in the collecting duct. All right? Extremely important for you to know. Okay. Okay, so something else I need you guys to know is this flow, all right? This is how that blood moves. So the bigger one is always the afferent, A. Bigger one is the afferent. Blood moves into this place, you see? It keeps moving. As it's moving, fluid is coming out from the blood, going downwards, going downward. When it's done moving, it will move out of this blood, this efferent, all right? So you need to understand this. Extremely important that you do. Extremely important that you do. Okay, let me see. The most important things. Now, when you talk about the renal tubule itself, all right? The renal tubule itself is the duct leading away from the glomerular capsule, ending at the tip of the medullary pyramid. It's divided into 4 regions. What are the 4 regions? Proximal convoluted tubule, the nephron loop, the distal convoluted tubule, all right? So this nephron loop is very, very important, all right? Collecting duct is not part of the nephron. That's something you need to know. Collecting duct is not part of the nephron. It's not, all right? In case of it, they ask you, this is the proximal convoluted tubule here, which starts from the glomerular capsule. I will show you the diagram. Then we have the nephron loop. The nephron loop is divided into 2. We have the descending limb and the ascending limb. The descending limb and the ascending limb. And something that is very peculiar in that nephron loop is that it has thin segments. That thin segment is simple squamous epithelium. Another place you can see simple squamous epithelium is in the alveoli. That's why every other thing is cuboidal. Every other thing is cuboidal. All right? If they ask you the epithelium of every other thing is cuboidal. But for this thin loop, it is what? Simple squamous. That's where they ask a lot of questions from. All right? So this is collecting duct that enters into the papillary. You see this chain? I don't know if you can see my screen properly. You will see this. This thing I just shaded now. You have to put this in your head. All right? Because they will give you this and tell you to rearrange it. So we have the glomerular capsule, proximal convoluted tubule. So fluid will move out of the glomerular capsule, enter the proximal convoluted tubule, from there to the nephron loop, from there to the distal convoluted tubule, from there to the collect. All right, so I need you to understand that. So this is what I was telling you about the juxtamedullary nephron. I'll be asking this question. They will be asking in the exam. Did I say I? They will ask in your exam. Oh, is it not loading? Do we have a problem with the graphics? Oh, it's lagging. I'm so sorry. So sorry. I think my network is not too strong. I don't know what is happening this night. Oh, it's lagging. It lagged. It's good now. Maybe it's because I'm talking too fast. Okay, it's good now. It's working. Okay, perfect. Perfect. I'm sorry. I'm trying to be very fast because I want to make sure that we don't make this thing too voluminous, all right? Because there are some people that are not here and they will need to go and look at this video. And if it's too big, it's difficult, all right? So this is juxtamedullary nephron. This is cortical nephron. Know that juxtamedullary nephron is, from the name, just at the medulla. So it is entering the medulla. Will this be posted to refer to later? Of course, it will automatically be posted on YouTube. That's why I used YouTube instead of Zoom. Because Zoom we want to save in my laptop, you know, and there's no space. So I broke the internet. Thinking it was my connection. No, it's not your connection. Sorry, it's me. It's my fault. I'm sorry. I'll use a better network next time. We are just trying this for the first time. Yeah. So the cortical nephron, let me go back. The cortical nephron is 85% of nephrons, but it is short. 85%, but it is short. The juxtamedullary is 15%, but it is very long, and it has what? Vasa recta. Please, this is the difference. This is the difference, and this is all you need to know for your exams. This is the cortical. This is the juxtamedullary. All right. Please, I want to fly. I want to fly now. I want to fly. Yeah, don't worry. So for the innervation, we know about sympathetic innervations. All right. We know about sympathetic innervation. We know about parasympathetic innervations. Sympathetic innervation, they inhibit urinary system. The same thing. Are you going to do 25 and 25 on the? Oh, yeah. Wait first. Let me finish this thing. It may not be 25 and 25, all right? But it depends on what the spirit leads. So the sympathetic reduces blood flow. That's why when you are running or when you are doing activity, you don't feel like urinating. Put that in your head. I'll jump. Okay. So look, this is the stages of filtration. This is stages of urine formation, rather. We have the glomerular filtration here. We have the tubular reabsorption. We have the tubular secretion. And we have the water conservation. Filtration, it comes out from the blood. Oh, the blood sees that it lost a lot of things, you know. And there are good things that it lost, like glucose, like electrolytes. The blood said, no, I want it back. The blood collects it back. That collecting back is known as what? Reabsorption. Reabsorption. The blood wants to get back its products. Now, when the blood is collecting the good things back, the blood mistakenly collects some bad stuffs like hydrogen. So what does the blood do? The blood pours it out. Secretion. So I need you to understand the sequence because they will ask you the sequence. We have filtration, we have reabsorption, we have secretion, and we have what? Conservation. Water conservation. All right? Okay, I'm jumping. Sorry. I'm moving with the speed of light. Yes. So this is what happens. Now, this is something else you need to know, guys. This diagram, you need to understand it properly. These are the things that could be filtered. They will ask you, one of the following could be filtered and one of the following could not be filtered, all right? Anything that is less than 8 nm can pass through. Anything less than 8 nm, like what? Like water, electrolytes, glucose, amino acids, fatty acids, vitamins, urea, uric acid, and creatinine. They may bring 3 of it and put one of the big ones there. You understand? Oh, it's small? Oh, I don't know how to make it bigger. I don't know how to make it bigger. Let me see. It's kind of bigger, right? Let me see if I can stretch it. I think it's bigger now. Okay. So now things like blood cells, protein, you know, they cannot pass through. Let me see. Okay, it's good, perfect. So they cannot pass through, but these are the ones that can pass through. All right. Let me see. I think if you go to slideshow, it will be bigger. Okay. But if I go to slideshow, I may not be seeing your I may not be seeing your charts. I won't know what you are telling me. But you know what? Let me go to slideshow, all right, and rush it off. Then I come back and see what everybody's typing. Let me go to slideshow. You are correct. From slideshow, from current slide. Slideshow from current slide. It's on slideshow now. And I don't know what people are saying, but I think it's better. So I'll just proceed. I'm sorry if I'm not seeing anything you are saying, but later I will look at it. Immediately we start questioning, I will look at it, all right? So let me move. So these are the things I'm talking about. These things are the things that the blood does not want, that will not pass through. And these are the things that will pass through. You have to know them, all right? Because these things are greater than 8 nm, but these are less than 8 nm. So the question you need to ask me is, what are the things that will ensure that These big ones does not pass through. Because if you see blood in somebody's urine, you know that this person has a problem. If you see protein, you know that this person has a problem. All right. So there are things like what? Like endothelial cell, glomerular capillary, the basement membrane, filtration slit, food processes, that's the podocytes. All right. Now, sorry. Okay. So now this is what I'm talking about. All right. So there are three major things, three barriers. We have the fenestrated endothelium of the glomerular capillaries. We have the basement membrane. Now, this fenestrated endothelium, right? Anything that is, it can only allow something that is less than 70 to 90 nm to pass through it, right? Anything less than 70 to 90 nm to pass through it. Basement membrane has proteoglycan gel, all right? And basement membrane allows things that are, it allows things that are less than 8 nm. 8 nm. Filtration slits allows things that are less than what? 30 nm. So the one that allows the biggest things are the fenestrated endothelium, 70 to 90 nm, followed by the filtration slits, which is 30 nm. Then the smallest is what? The basement membrane, which is what? Which is 8 nm and below. Very, very important for you to know this. Extremely important for you to know this. Oh, somebody said I'm not able to join the chat. I don't know how they join the chat, but I will continue for now so that we don't waste much time. If you can't join the chat, it's fine. Just pay attention. That's fine. The water electrolytes, glucose, fatty acid, amino acid, and nitrogenous weights and vitamins are the things that we pass through. Always remember them because that's what they will ask you in your exam. They are the things that will pass through. If we see protein in your urine, you have proteinuria, which is a problem. If we see blood in your urine, you have hematuria, which is a problem. And what you need to know is that this is physiology and anatomy, correct? Physiology is what? Function, function, function. The right function. I'm able to move my hand. Physiology. A situation where I want to move my hand, but I'm not able to move my hand, it becomes what? Pathology. And what we are discussing today is physiology. I'll still have a pathology class with you guys. All right. But you guys have to understand this. And also, there are some pathology that are actually physiological. For example, people that run, all these runners or swimmers, sometimes they have what? Proteinuria or hematuria. Why? Because of strenuous exercises. It's actually physiological, but it sounds pathological. All right. So, but that's by the way. We have blood hydrostatic pressure. We have hydrostatic pressure in the capsular space. All these things affects. Let me just go straight to this diagram. If you can see this diagram very well, which I believe all of you can see. So this is where blood enters in. This is where blood goes out. All right. Now, this blood entering in is entering with a force, which we know as blood hydrostatic pressure. And that blood hydrostatic pressure is 60. But there is a counter force opposing it, which is the colloid osmotic pressure, COP. This is the COP, the 32. And we have the capsular pressure, which is 18. Now, this force opposing it, if you add the two of them together, it's around 50. All right. But the BHP is greater by 10. So this 10 will push the fluid from here into this place. That's what we call filtration. So filtration occurs because the blood hydrostatic pressure is greater than the combination of both the colloid osmotic pressure and the capsular pressure. Extremely important that you understand this. All right. Now, the question is, if the GFR is too high, mind you, if somebody is having too much fluid in the blood, it is high blood pressure. If the person is having too less fluid, it is what? Low blood pressure. Fluid determines the pressure. Simple. That's the basic. If the GFR is too high or too low, it becomes a problem. It becomes a homeostatic problem. All right. And how does the body control its homeostasis? There are three regulations: the renal autoregulation, sympathetic control, and hormonal control. I'm not going to spend too much time on it. Renal autoregulation is just itself. It's adjusting itself. It can be myogenic mechanism. It can be tubuloglomerular feedback. All right. It's as simple as that. Then the myogenic mechanism, right, is usually muscle, myogenic muscle. And what is it about? If the blood pressure increases, the afferent artery becomes stretched. So it reduces the afferent artery constricts rather, preventing blood from entering inside. It's as simple as that. I need you guys to think about it in that direction. Oh, the blood pressure is high. Why? There is too much fluid in the blood. the afferent does what? Just lock up. It locks up. And if arterial blood pressure falls, the afferent does what? Open, so that blood can come in and increase the pressure. It's as simple as that. That's just the body's way of controlling itself. So in case of if you see any question like this in the exam hall, please always think of the what? The afferent. A, not E. A. Why? Because the A is big. All right. If you lock it up, it reduces pressure. If you open it, it increases pressure. It's as simple as that. No much story. Then we have the glomerular feedback. I know I'm speaking too fast, but I'm sorry. I have to do that. All right. So we have the. Oh, somebody said we are stuck on the slide. Let me see the charts. Oh, you said, did anyone to? Has it moved? Oh, so when I did it, so that's the point. That means I won't do it. Sorry, I won't do it. I won't do it slideshow anymore because it's got stuck when I did slideshow. He can't see the chat and his screen is frozen. Can you see me now, guys? Say yes. Say yes. Let's continue. Don't worry, if you can't see the slide, just listen. The most important thing is when I start throwing in the question, you will see it. But I don't think I'm frozen now. Yes, please don't. Okay, perfect. So I think it's because of that. So we won't do it like that anymore. I will just increase the size here. Okay, I'll continue. sorry about that, but I'll continue. All right. So this is renal autoregulation. Now, I need you to see this diagram. The screen is weird. It's like half. Don't worry about it. Just pay attention, all right? What you need most is equation. This is just a recap, all right? What you need most is equation. If you can see this diagram, I believe you can, because I'm seeing it on that screen now. If you can see this diagram, it just shows you what glomerular feedback does. When there is high GFR, glomerular filtration rate, right? It increases the sodium chloride load in the nephron. This sodium chloride load in the nephron will cause the macula densa to secrete ATP. Then the ATP will metabolize adenosine. Adenosine will stimulate granular cells, and granular cells will cause afferent arteriole to constrict, thereby reducing GFR. So at the end of the day, at the end of the day, high GFR, when there's high GFR, the tubuloglomerular feedback will reduce it. All right. So please pay attention. Stop. Don't be overwhelmed. We are just starting. We are just 30 minutes. Don't be overwhelmed. Now, please, this is the hormonal part. Look at it. This is the hormonal part. It will appear on your screen now. This is the hormonal part. For the hormonal part, you need to know that when there's a drop in pressure, the kidney produces renin. And renin will convert angiotensinogen to angiotensin 1. Angiotensin 1 will be converted to angiotensin 2 by ACE. You can be asked, what is the function of renin? And you can be asked, what is the function of the ACE? I will show you the question. All right? You can be asked any of these questions. You understand? Now, angiotensin 2 will we do three things. One, it will lead the hypothalamus to start feeling like drinking water. There'll be elevated blood pressure. There'll be vasoconstriction, and there'll be increased aldosterone production, which leads to water retention. These are the things that the hormonal will do. Don't worry, I'll give you a question and you will understand it properly. I'm trying to jump. I don't want to discuss everything. I'm trying to jump so that you will not be overwhelmed. Let me see. Hold on, guys. I'm trying to jump. There are some things that are very important. Then you need, okay, yeah, we've discussed this already. We've discussed the reabsorption. Okay, please, I need you guys to know the function of aldosterone. All right? The function of aldosterone is very, very important for you to do, all right? Aldosterone it helps to retain salts. And whenever it retains salts, water follows it. So aldosterone is produced when the blood pressure is low. Remember, I told you blood pressure is synonymous to fluid accumulation. So when there is a lot of fluid, right, it means there's high pressure. When there is low fluid, it means that there's low pressure. So when there is low fluid and there's low blood pressure, the body releases aldosterone from the cortex of the adrenal gland. It brings out aldosterone. Aldosterone will do what? Will retain salt, and water will follow salt, thereby increasing the water volume. I need you to understand the mathematics. It's as simple as that, and I will not talk about it again. We have other things like the natriuretic peptides, which I will give you in a question. I don't want to discuss it now. Now, another thing I need you to know is the antidiuretic hormone, ADH. Extremely important for you to know. That one, you need to know it, not just for this exam, also for your hormone. All right. If you understand these things very well, throughout the semester, there are some things you don't even need to know. Anatomy is intertwined. That's what you need to know. All right. So what ADH do is that ADH makes the collecting duct more permeable to water. So water enters the tissue. All right. Usually when you are dehydrated, that's when ADH is produced. Either when somebody is dehydrated or when there's blood loss, all right, or when there's high osmolarity. That's when ADH is secreted. All right. You need to know parathyroid hormone, but I will discuss it in question. I don't want to discuss it here. Water conservation is also important. You need to know about it. You need to know the functional relationship of the nephron. And this diagram is something that you need to just look at before you enter the hall, all right? I will give you some questions for you to remember it with. Let me see if there is something else I need to discuss before we jump into the questions. You guys can't wait for us to jump into questions. Eh? So please, I told you about the ureter and the bladder being retroperitoneal. I told you the meaning of retroperitoneal. You must not forget. Even if that's the only information you know about the ureter, no problem. Please. It is retroperitoneal. And I told you the meaning of retroperitoneal. The peritoneum covers it anteriorly, pinning it to the posterior wall. All right? So that's the idea. That's the meaning of retroperitoneal. So the kidney and ureter are retroperitoneal. All right? Okay. Then this is the bladder, the urinary bladder. The urinary bladder is transitional epithelium. Also important, this is the information you need here. It's transitional epithelium. Okay. Then this is diagram of the bladder. You have it in your slides, so check it up later. I don't want to talk about kidney stone because we are not doing pathology, all right? But it's something that you need to know later. I don't want to prolong this discourse. This is micturition. That's urination, voluntary and involuntary, all right? And when this is voiding of urine, this is renal insufficiency. When there's renal insufficiency, it's always hemodialysis, and after hemodialysis, it's always transplants. Put that in your head. All right. Okay. So, is anybody confused with whatever any of the things I discussed? If you're not confused, then I can continue. Are you ready for my questions? Okay, give me a moment. So, please, the rules of this engagement is, I want it to be a very interactive session so that you guys will not get bored and sleep off. All right. We have about 40-something people here to 50 people. I'll put a question. I need you to answer it very fast. I'll be putting questions 30 seconds. Right? Answer it very fast. There are some questions I will tell you, oh, this question you need to hold on. I'll tell you, oh, this question you need to hold on, so that I can put in, hold on. I'll tell you this question you need to hold on. Let me put in the options. So you hold, I put in the options, and you answer your question immediately, all right? Give me a moment. Let me get some of those questions I want. Wait, one question, please. ADH makes collecting duct. It makes it permeable to water, for water to flow in. Remember, collecting duct is the apparatus that takes water out, right? Takes water out from the collecting duct to the papillary, then from the papillary to the minor calyx to major calyx, all right, to pelvis, to ureter, to bladder. So it goes out. So, but when you are dehydrated, we don't want to lose water. Instead, we need water. So that water that is going out, ADH will make the collecting duct become permeable, and the water will start going, instead of going downwards, it will start entering the blood, going out of the collecting duct into the blood, instead of going downwards. All right? So that's the thing. So please, if you have a question, put it in the box. If not, I will bamboozle you guys with questions. Okay. So after this revision, tomorrow after your exam, you can now tell me if you want us to keep doing revisions before every exams like this. We'll know if it is worth it by tomorrow, all right? Not now. Tomorrow we'll know if it is worth it. We will get our scores. Yes, that's why for people that are in my class, that's why we are using Connect, so that you see your answers. You know what you get wrong, and you know. Okay, since you are ready, please, you know the rules of engagement. Everybody must answer. If you don't know the answer, write not sure. Simple. If you want me to explain more, just say, please, can you explain more? But please, you must write something. If you don't write something, I will not be happy. Please, I need to be very happy this night. Okay, so let's start. Let's start. So I'm pasting this equation now. Hold on. So this question, it says, which of the following is not true? No, don't be scared. Don't be scared. Okay, somebody asked a question. If afferent and efferent arteries constricted at the same time, what would happen to the GFR? It becomes like the GFR will not increase and reduce, and it becomes a problem. There must be movement. Do you understand? There must be movement. So even when afferent constricts, right? When afferent constricts, it's constricting momentarily to drop the pressure. Do you understand? So sometimes afferent and efferent can constrict, but it's just all about dropping the pressure momentarily. It cannot continue constricting. No. It's just the moment. If you continue constricting, it will drop, it will kill the blood pressure, and that person can die of hypotension. There must be movement. All right. Okay. My question. Number one. Which of the following is not true about the anatomy of the urinary system? Don't answer yet. I'm going to post 5 options. Then you tell me if it's A, B, or C. Please, I need you to think about it properly. This is A. This is A. That's A. I know some people's own will be lagging, and I'm sorry about it. Then this is B. Then this is C. Then this is D. Then this is E. Okay. So, which of the following is not true about the anatomy of the urinary system? A, the kidneys are retroperitoneal. B, the ureters connects the kidneys to the urinary bladder. C, the urethra of males is longer than the urethra of females. D, the kidneys are at equal heights within the pelvic cavity. E, the right kidney is located more inferiorly than the left kidney. This class is hot, oh. This is a very intelligent class, oh. Okay. You people do not even allow me to land. You've already started giving me the right answers. Okay, that's good. No, the answer is not A and D. The answer is D. They are correct. You guys, all of you are correct. You know, they said which of the following is not true. Please. When you are answering exams in anatomy, they are always putting notes, and they'll put it small. If you are not paying attention, you will not even know. What they are telling you not means that all of them are true, apart from one. And the one that is not true is that the kidneys are of equal height. Like I mentioned it, I showed you the diagram. the two kidneys are not of equal height. The right kidney is lower just because of the liver is pressing down on it. Why the left kidney is more superior. All right. So that's the kind of, that's what you should be expecting. Things like this. Okay. I'm just giving you the easier questions for now, but because so that you guys will not be discouraged before I throw the bomb. So for this one, I'm not gonna post the options. I will give you the options. So just pay attention. I will say it by mouth. The dash is not an organ of the urinary system. Aren't they in the abdominal cavity? They are in the abdominal cavity. They are. The two of them are in the abdominal cavity. But the thing is that the right kidney, because it's under the right kidney is under the liver. All right. The liver, liver is bulky. So the liver is pressing it down. But the left kidney is up a little. All right. Like if you look at this diagram, let me show you this diagram. This diagram. Look at this diagram. Let me see if it has appeared here. It's going to appear now. 1, 2, 3. Appear. So if you look at this diagram, right, you see this is the right kidney is a little lower than the left kidney. All right. So that's the major thing you need to know. That's the major thing you need to know. All right. Okay. So let me continue. So the question is, the dash is not an organ of the urinary system. Options: A, urethra; B, liver; C, ureter; D, urinary bladder; E, kidney. Answer quickly, 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 quickly. 20 people need to give me the answer. Lisa, okay. I need keep going, keep going, keep going, keep going. Perfect. So you guys are correct. All of them are organs of the urinary system apart from the liver. It sounds very easy because you've read. You see it? That's the beautiful thing about studying. Some people that have not studied will come to the exam hall and they will see this question and it will be like, Jesus, what did professor give to us? All right. So it's important that you know that. Okay, let's go to the more stronger questions. I don't want you to. A byproduct of protein. Let me post it in the. I'll post it now. I will. Are the exam questions all going to be multiple choice? All your exams are always multiple choice. Multiple choice is a standard exam. Even when you are writing NCLEX, it's multiple choice. All right. Everything is multiple choice. Don't worry, nobody's telling you to fill in. Okay, so it's just I'm just giving this so that will be faster. All right. So look at this question. Look at this question. A byproduct of protein catabolism dash constitutes approximately 1/2 of all nitrogenous wastes. It is a byproduct and it constitutes 1/2 of all nitrogenous waste. The options, please listen to the options. A, urea. B, creatinine. C, uric acid. D, azotemia. E, ammonia. A, urea. B, creatinine. C, uric acid. D, azotemia. E, ammonia. I need 20 people. We are up to 70 here, so I need 20 people to produce the answers. And I'll be sure that you guys are knowing it. Okay. Somebody said creatinine. Somebody said urea. Keep going. Keep going. Somebody said A, that's urea. Somebody said B, that's creatinine. Keep going. Keep going. So we are fighting between A and B. A and B. Okay. Let's go. Let's go. Keep going. Keep going. Keep going. Keep going. Okay. Okay, good. So the answer is urea, please. The byproduct, the question is a byproduct of protein catabolism. What is byproduct of protein catabolism? The answer is what? Urea. All right. I will show you this particular place in the slide. If you look at the beginning of the slide, here. Look at this point I told you that is very, very important. What do you see? What do you see? Protein. This is protein. The first one is urea formation. Proteins break down to amino acid. Amino acid break down to ammonia. Like amino acid, they remove ammonia from amino acid. It forms what? NH2 from amino acid. It forms ammonia, right? Now the liver converts ammonia to urea. So proteins are broken down to what? Urea. The byproduct of protein catabolism is what? Urea. That's what you should know. Uric acid, if they ask you the byproduct of uric acid catabolism, it is what? The byproduct of nucleic acid catabolism, rather, is what? Uric acid. Byproduct of protein catabolism is urea. Byproduct of nucleic acid catabolism is uric acid. Creatinine phosphate catabolism, the byproduct is what? Creatinine. These are the three major byproducts you must know. You must know. You must know urea, you must know uric acid, you must know creatinine. Okay. I believe you guys got this. So the answer is urea, please. Not creatinine. The answer is urea. All right. Okay. Let me give you this. Creatinine is creatine phosphates. Muscle. When muscle break down, it gives creatinine. All right. Yeah, but protein is urea. Uric acid is nucleic acid. All right. Okay. That's good. I believe you got it. So look at this question. I'll give you the option. I'll call the option. I won't post it in the group. Which organ system does not excrete waste? They will give you different organ system. They're asking you which one does not excrete waste. Option. So let's go fast. We are behind. Option A, urinary system. Yes, muscle. A, urinary system. B, cardiovascular system. C, integumentary system. D, digestive system. E, respiratory system. Which organ system does not excrete waste? A, urinary system. B, cardiovascular system. C, integumentary system. D, digestive system. E, respiratory system. Oh yeah, let's go. I need up to 20 people to put an answer there. If you are not sure, write not sure. If you want me to explain, I will explain. But I will tell you the correct answer. Perfect. You guys are correct. You guys are very, very correct. It's cardiovascular system. Cardiovascular system does not remove any waste, too. Please, others removes waste. All right. So that's the answer. Perfect. So let's go faster. Let's move it. Let's move it. Please don't sleep on me. Oh, if you are sleeping, wake up. Hit yourself like this. Hit yourself because you need to pass your exams properly. All right. I know you did a lot of sacrifice to be here, and I appreciate it. All right. I appreciate myself also for bringing out time. So the medial concavity of the kidney, not medical, the medial concavity of the kidney is called the dash, which admits renal nerves, blood vessels, lymphatic vessels, and ureter. Let me not give option in this one. Let me see if you can. Some people here can get the answer. Let's go. Thank you so much. Thank you. You guys should click the like button. I need the like button to get to 60 because you guys are more than 60 here. Thank you. Okay, so I need guys to give me the answer to that question. I'm not giving option. Okay, not sure. Let's go. Somebody say hilum. Let's go. Hilum. Let's go. Let me see if I can get up to 30 hilums. Somebody's asking, hilum? Let me see. Keep going. And keep liking. Okay. Hilum. Keep going. Okay, the option. Let me give you the options now. Medulla, corpuscle, cortex, hilum, and capsule. Yes, the answer is hilum. All right. If you remember this diagram, let me show you this diagram. Yes, you guys are correct. Let me show you guys this diagram. Minecraft. I don't know how to do it. Please teach me when I come to class. I'm sorry. I'm sorry it's lagging, but if you are looking at that picture, that area where you see the renal artery, renal vein, you understand? That is what we call what? Hilum. That area, that space where they entered from. All right? That's what we call the hilum. So that and the hilum is the answer. The question says the medial concavity of the kidney is called the dash. That's hilum. All right? Okay, let's go to something stronger. Now there's this question. Let me see if you guys can get this question. This one is also a giveaway. This is a giveaway. I'm giving all of you giveaway. All right. This giveaway is $100 worth. Lagging. Sorry. Oh boy. Just bear with me, guys. Bear with me. Okay, so I just posted a question now. But why is this thing lagging? I don't understand it. Is there something I'm doing wrong? I use this thing for the other group and it's lagging. It's lagging, Professor. Sorry. Let's see if we can. Maybe because I'm talking too fast. Maybe because I'm talking too fast, I guess. Okay. Yeah, so what's the answer? 4 people answered. Let's go. I need everybody to answer. We are more than 70 here. Everybody, please. I can't hear because every other person can. In? Yes, you guys are correct. Yes, that's correct. Okay, give me the answer to. I think it's better now. It's just my network. Please bear with me. My network, I don't know what is wrong with my network this night. All right. So, but we will have to manage it. All right. So please, maybe later you can see the video. Look at this question, guys. Renal pyramid voids urine into the dash. Renal pyramid voids urine into the dash. No, I'm not frozen. I can see myself. I'm not. Renal pyramid voids urine into the dash. Renal pyramid voids urine into the dash. Okay, keep going. Okay, you know what I will do? Let me end the sharing. Let me see if it's better. I think if I end the sharing, it's better. Probably that sharing is what is causing it. Is it better? Can you see me very well now? Better? If it's better, let's see. Thumbs up if it's better. Yes, it's better. Way better. Perfect. Oh, that is the formula. So I think what I will do for next time, don't worry, guys. We are just trying to get a hand of on this thing. Smoother video. Perfect. So what will happen henceforth is whenever we start a session, I share this stuff. We just discuss 10 to 15 minutes on it. Then I remove it and we just do our questions. All right. So the question is: a renal pyramid voids urine into minor calyx. The answer is minor calyx. The answer is minor calyx. I remember telling you to learn the sequence. All right. Learn the sequence. Collecting duct, papillary, minor calyx, major calyx, pelvis, ureter, bladder, urethra. Please You should know that, all right? You cannot afford not to know it. So if they ask you this question in exam hall, you should be able to get it. Okay. Now, give me the answer to this. Hold on. Okay. This is equation. Perfect, perfect. Yes, I can see that it's no longer hanging. So this is the equation. Please, you don't need to answer. Let me post the options for you. This, the equation, a single lobe of the kidney is comprised of dash. This is A. This is B. This is C. This is D. And this is E. So a single lobe of a kidney is comprised of A, 2 calyces and a renal pelvis, B, 1 pyramid and the overlying cortex, C, 1 major calyx and all of its minor calyces, D, a renal medulla, 2 renal columns, E, 1 collecting duct and all nephrons that drain it. Answer. This is a very important question because I think it came out in one of the exams. Yeah, it came out in one of the exams. I saw it, something like that. So let's go, let's fire. Okay, somebody say E, somebody say B, somebody say 1 pyramid and the overlying cortex. 1 pyramid and overlying cortex is B. Okay. Okay, I think there are a lot of B's. The B's have it. The B's have it. Let me do it like you're in the court. The B's have it. So a single lobe, please, if you don't know anything in urinary, you must know this part, all right? Please, it's not E. The answer is B. A single lobe of a kidney is comprised of 1 pyramid and the cortex overlying it. You see that pyramid that looks like this? Then the cortex above it. That is what we call lobe. That's why the artery that passes through it is known as what? Interlobar artery. Do you understand? Interlobar artery. So it's important that you know that, all right? Please don't forget this question. Don't forget this question, all right? Okay, how about this one? This one is very easy, straightforward. But I'll still give you the options. The average person has approximately how many nephrons per kidney? How many nephrons per kidney does the average person have? A, 1.2 million. B, 2.4 million. C, 3.6 million. E, 4.8 million. D, 4.8 million. The E, 5.6 million. 1.2, 2.4, 3.6, 4.8, $5.6 million. I said dollars. Hey, God. Okay, keep going. Let me see. Keep going. Keep going. That was 1.2 billion. Okay, please. The answer is 1.2 million. Thank you so much. You guys are great. Thank you so much. Now look at this question. Very important question. It's always important to all professors. Look at this question, guys. Which of the following form the inner layer of the glomerular capsule and wrap around the capillaries of the glomerulus? Which one forms the inner layer and wraps around the capillary? All right. We have the macular denser cells. We have the messenger cells. Who wants to be 1.2 billion? So please, A, we have the macular denser cells. We have the B, the messenger cells. C, the nephrocytes. D, the podocytes, and E, the monocytes. Quickly, quickly, quickly. Speed of light. Macula densa, mesangial, nephrocytes, podocytes, monocytes. Answer. Speed of light, guys. Speed of light. Speed of light. Keep going, keep going, keep going. We are up to 50 here. Keep going. Let's have it. Let's have it. Let's have it. Okay, good. You guys are great. This class is too brilliant. You people are so hot, man. I'm very confident about you guys. You know, you do me proud. Okay, look at this question. This one, I'm not going to give you option, please. I'm not giving options. The major calyces merge to form a single funnel-shaped dash. The major calyces, where do they empty into? Let me see. Okay, somebody's already on fire. Somebody's already on fire. Keep going. Keep going. Somebody said pelvis. Somebody said podocytes. Somebody said renal pelvis. Keep going. Keep going. Pelvis. Pelvis is winning it. Let me see if somebody thinks differently. Keep going. Keep going. Keep going. Keep going. Perfect. The answer is renal pelvis. The options are column, cortex, medulla, pelvis, pyramid. Please, you need to know that the major... You see why I told you that you must learn that chain? You must learn that sequence. So look at this question. This is a very important question that always comes out. Look at it. I'm not giving option. Somebody should give me the answer. I need 10 people to give me the answer. Which of the following is not composed of cuboidal epithelium? In the kidney, which one is not composed of cuboidal epithelium? Which one is not composed of cuboidal epithelium? I'm not giving options, sorry. Which of the following is not composed? Which one in the kidney? Which one is not? There's something I mentioned specifically that they always ask. Keep going, keep going, keep going. Fire, fire, keep going. Keep going. Keep going, keep going. Keep going. Perfect. Okay, somebody said hints. Actually, no, don't worry. I'll just tell you. You guys are extremely correct. It is the thin, if you just see THIN, thin segment of the nephron loop. I mentioned it. It is simple squamous. Yes, yes, yes. It's simple squamous. You're correct. You understand? This is the kind of question you are going to see in your exam. All right? Okay, look at this question. Extremely important question. Look at this question, guys. I'm going to put the option here for you. This is the question. Cortical nephrons can be distinguished from juxtamedullary nephrons by... This is the A. This is A. This is B. This is C. Yeah. Okay, yes, I'm coming. Just let me paste all these things. This is C. Just give me a moment, all right? I'll get your question. I'll answer you. Just a moment. Then this is D. Then this is E. Okay, so as they're answering, somebody asked me, can you explain the thin and the thick for a second? Yes. Remember, the nephron loop, we have the proximal convoluted tubule, right? The loop is the one that went down from the glomerulus. So if you see my hand, you see, This is the glomerulus. This is my hand. This is the glomerulus. So the blood vessels entered inside. The afferent entered. The efferent came out. So when they are inside, this glomerulus drags out what? Fluid from the blood. That fluid will go down. Pew! This place that is going down is the nephron loop. So the nephron loop, the first part is the proximal convoluted tubule, right? Then after that, you have the descending loop and the ascending loop. So that descending loop has a thin part of it. That thin part is the one that is simple squamous. Every other part is cuboidal. So if you look at that diagram, you see that it was fat. Suddenly it becomes slim, went down, then now starts going up. So that descending one, the thin one, that slim one, is the squamous, simple squamous. All right. Okay, so back to our question. Cortical nephrons can be distinguished from juxtamedullary nephrons by, yes, you guys are wonderful. The answer is A, their location within the renal pelvis. Remember, I told you the cortical is in the cortex. The juxtamedullary is just at the words medulla. Just at the words medulla. So it is based on their location. Yes, you're correct. It's based on their location. That's how they are classified. It even carries the name cortex in the cortex. All right. So please, you can never miss that question if you see it in the exam. You cannot miss it. If you miss it, I'll fight you. Okay. See, this is you see some of these questions are so simple now, right? Because you've studied, and I believe all of you have studied, and all of you have seen my video on urinary. So it becomes so easy for you. Now look at this question. Look at this question. The transition from the afferent arteriole to an efferent artery occurs where? I'm not giving option, no. Okay, fine. Let me give you options. A, glomerulus. B, medulla. C, cortical radiator vein. D, peritubular capillaries. E, vasa recta. I am very fast. I am very, very fast. I'm rushing because I need to finish this thing and jump into digestive very fast, all right? Because, you know, all of them carries equal weight. Okay, everybody, come on. We are up to 50 here. I need at least 20 people to make that answer very fast. If you don't know it, right, not sure. Nobody is sitting at the fence here. Everybody has to type. Nobody is going to sit at the fence, guys. The transition from an afferent to efferent artery occurs where? Glomerulus, medulla, cortical radiator, peritubular capillaries, and vasa recta. Yes, you guys are wonderful. The answer is what? Glomerulus. Because you see, the glomerulus, that's where A entered and E came out. So it's just within the glomerulus. All right. They are just trying to make sure you are very well acquainted with the diagram. I hope I'm not lagging too much now. I guess I am not, because you guys have not complained yet about it. So I think I'll be following this formula now. Okay. Please, this question is long. So allow me to paste the options before you start answering. Allow me to paste the options before you start answering. This is A. Which of the following correctly traces blood flow from the renal artery into the cortex? This is A. This is A. Then this is B. Incoming missile. B, incoming. This is B. Then C, incoming missile. C. Then this is D. I hope it's not getting tougher yet. Trust me, when you see these questions or these similar questions in the exam hall, you just smile. You'll be like, what is this? Please, is this why I'm stressing myself? Is this why I've been awake all night studying? So, which of the following correctly traces blood flow from the renal artery into the renal cortex? Right? That's A, B, C, D, E. Okay. We are up to 40 here, so at least 20 people should be able to give me the answer. Okay, let's fire it. Let's step it up. If you're not sure, right? You're not sure. Step it up. Okay. I'm so impressed, though. Honestly, like I am extremely impressed. Like it's making this stress worth it. It's making it worth it. Honestly, like I'm always very happy when you guys are okay. Not sure. Not sure. Okay, that's good. Okay. Okay, perfect. So yes, the you guys are correct. That answer is C. The flow. See with the question. You need to know this question, understand this question, because there's another one I'll give you now. You will see that they can confuse you. First, what are they asking me? They're asking me about artery. That's the question. Which of the following correctly traces the blood flow? So, first of all, what are they asking me, and where is the starting point? Where is the starting point? So, for this question, which of the following correctly traces blood flow from the artery, renal artery? Okay, renal artery. That means they're asking me from outside to inside, because the cortex is coming in. So renal artery, because if you know how blood moves from the heart, all right, enters the kidney. This is the kidney from the artery, goes inwards to the cortex, then gives it to the vein, and the vein starts coming back out. That's how it works. Coming back out, then to the heart. That's just how it's just a circle. All right. So they're asking you renal artery from outside going inwards. So you guys are completely correct. Segmental artery becomes interlobar artery, which becomes arcuate artery. You see, arcuate artery. Arcuate artery now leads to what? Cortical radiator. Cortical radiator. All right. Then from there to the efferent, enters the glomerulus, then efferent, then start coming back through the veins. All right. Now look at this. Look at this. Interesting question. Almost the same thing, but they are trying to confuse you, and I am sure that you guys will not allow them to confuse you. This is the question. Wait for the options. This is the question. Wait for the options. So let's go. Don't open your slide, though. Don't open your slide. Just focus on this thing and challenge yourself. I need you to challenge yourself. All right. So this is A. Incoming missile, incoming missile, incoming missile. This is B. Incoming missile. This is C. Digestive system. I don't think we will. I'll be able to discuss it. I will just go straight to digestive system questions. All right, so that I can leave you guys to go crash, to go sleep. I know some people are already dozing. Wake up! Wake up! Wake up! Don't sleep. I'm very dramatic. I think so. So this is E. Okay. So which of the following correctly traces blood flow from the renal cortex to the renal vein? Now, renal cortex and renal vein. Let me see. Let me see people that can challenge themselves. But if you're not sure, please write you're not sure. No shame in it. No shame in it. All right. It helps you to tell yourself, oh, I'm not really sure about this thing, but let me see what the answer is. You guys are great. You guys are just too much. If I know that you guys are so good in this, in this urinary, I wouldn't even touch urinary now. We just got right here. You guys are just so good, eh? So now it's not good. Okay. Now let me explain it for you. For the other people that are not too sure, they say which of the following correctly traces blood flow from the renal cortex? You see, now they're asking you that question from inside to outside. And what are they asking you? Which one comes out? Vein. Vein comes out. So it is which one is the most inside? The cortical what? Radiator. So the cortical radiator to the arcuate to interlobar to renal vein. Because we don't even have segmental. So interlobar to renal vein. So the answer is E. Very correct. The answer is E. So you need to know when they're asking you about the vein or the artery, when they're asking you about is it going in or coming out, always you need to remember that, because artery, it goes in, hands over to the vein around in the cortex, and comes back through the vein. It's as simple as that. Okay. I love that question. Very challenging. Now, let me challenge you guys also with this. So, you know, these are the very strong questions that you'll be seeing in the exam. This is the strongest questions you can even see. So that's the question there. Which of the following, what is the correct, what is wrong with my glasses? What is the correct branching sequence of the arteries in the kidney? You see how they ask this question? It's the same question they were asking you, but they just twisted it in a different format. This is A. This is B. This is C. Incoming, 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 incoming. Incoming missile. Incoming, incoming, incoming. Is this the same thing? Okay, no. This is C. Just want to make sure I'm not making a mistake. This is E. And this is F. No, this is D and this is E, rather. Okay. So, what is the correct branching sequence of arteries in the kidney? What is the correct sequence? Correct branching sequence of the arteries in the kidney? That's A, B, C, D, E. Let's go. Let's go. We have to more than 40 here. So I need up to, 30 people to respond to that question. Okay. You guys are wonderful. Oh. Like I'm having fun. I'm having fun, man. You see? You'll be thinking that there is one big deal about the questions, but there's no big deal, man. Okay. Thank you so much. The answer is E. You're correct. You are extremely correct. Now look at this question. Trying to be faster, right? Look at this question. I'll put in the options in the box. I'll put in the options in the box. This is A. This is B. This is C. This is E. This is D, rather. Please, I'm ending it at D. Okay, so tell me, the dash innervation of the kidneys reduces urine production. Why the function of its dash innervation is unknown? Answer. Okay. You guys are very, very correct. Okay, I'm happy that everybody knows that question. I'm so happy that you know that question. The answer is A. So happy that you guys know that question. Yes, the answer is A. Somebody say A. Okay, that's fine. So look at this question, guys. This is what I was telling you, that you need to know the hormonals. Renin hydrolyzes angiotensinogen, which is released from the dash to form angiotensin 1. Option, I'll give you the option here. Options: A, the lungs; B, kidney; C, liver; D, heart; E, spleen. Okay, I should repeat. Hold on. A, lungs; B, kidney; C, liver; D, heart; E, spleen. E, spleen. Okay, keep going, keep going. You're correct. So the liver produces angiotensinogen, and you remember angiotensinogen is what? Inactive what? Inactive protein. It's inactive. So when the liver produces it, what breaks it down to angiotensin 1? Something breaks it down to angiotensin 1. What is that? Please put in the answer. What breaks it down to angiotensin 1? What breaks it down to angiotensin 1, and where is that thing that breaks it down produced? Yes, I agree. The liver produces angiotensinogen, but something breaks down angiotensinogen to angiotensin 1. And where is it produced? Okay, somebody say renin kidney. Somebody say renin kidney. Keep going. Keep going. Renin kidney. Correct. I just want to be sure that a lot of people know that it is renin. So the renin produced in the kidney breaks down angiotensinogen to angiotensin 1. Now, ACE, that's angiotensin converting enzyme produced in the lungs, converts angiotensin what? 1 to angiotensin 2. All right. Thank you so much. I hope I'm no longer lagging. I don't think I'm lagging. Okay. So look at this question. Look at this question, guys. Which of the following would reduce the glomerular filtration rates? Which of the following will reduce the filtration rates? A, this A, B. Please, everybody has to attempt this question. We are more than 40 here. This is B. This is C. This is D. And this is E. Okay, so which of the following would reduce the glomerular filtration rates? Vasoconstriction of the efferent arteriole, a drop in oncotic pressure, vasodilation of the afferent, vasoconstriction of the efferent, an increase in what? Osmotic pressure in the glomerular capsule. Answer. Let's go, let's go, let's go. We have more than 40 people here. Keep going, keep going, keep going. Vasoconstriction of the efferent. Okay, keep going, keep going. That's D. Keep going, keep going. Come on, guys. We know the rules and regulations. We are 40. I have to have 40 answers. All right. Okay, but you guys are great. So for people that don't understand it, thank you so much. For people that don't understand it, we are talking about which will reduce the GFR, meaning that that person has hypertension. All right, has hypertension. So if he has hypertension, for you to reduce the GFR, what do? You lock up the efferent. If you immediately lock up the efferent, the blood flow will drop. Simple. That's what they're asking you. That's what they're asking you. Okay, so look at this. Look at this. This one, I will read out I'll call the options for you. You understand? I will soon leave the kidney. The kidney. ADH was for water retention. Yeah, of course. Antidiuretic hormone is usually produced when maybe somebody has blood loss or dehydration. I keep forgetting that my camera is here. So antidiuretic hormone is when somebody has blood loss or dehydration, right? Meaning that the volume of blood is reduced. So if the volume of blood is reduced, the body doesn't want to lose blood. So what does the body do? The body will deploy the antidiuretic hormone. It will go to the collecting ducts, make it permeable. So instead of you losing more fluid through urine, it will take the fluid back into the blood. That's the function of ADH. All right. Yeah. So this question says, no, I'll give you the option for this question, please. The mechanism of stabilizing the GFR based on the tendency of smooth muscle to contract when stretched is known as A, renal autoregulation, B, myogenic mechanism, C, tubuloglomerular feedback, D, sympathetic control, E, renin-angiotensin-aldosterone system. The mechanism of stabilizing the GFR based on the tendency of smooth muscle to contract when stretched is known as what? Renal autoregulation, the myogenic mechanism, the tubuloglomerular feedback, sympathetic control, the renin-angiotensin-aldosterone mechanism. Answer. Let's go. You say I should repeat? Renal autoregulation, myogenic mechanism, tubuloglomerular feedback, sympathetic control, the renin-angiotensin-aldosterone system. Perfect. The answer is B. You're correct. All of you are wonderful. It's myogenic. All right. Now, in response to, look at this question, extremely important question because it's clinical. All right. And this is what you need the most. In response to a drop in overall blood pressure, all right, when blood pressure drops, that's what they're asking you. That stimulates constriction of the glomerular inlets and even greater constriction of the outlets. Options: A, azotemia. Wow, terrible. A, azotemia. B, sodium chloride. C, parathyroid hormone. D, aldosterone. And E, angiotensin 2. Think about it. When blood pressure drops, what does the body do? That's what they're asking you. What is deployed? Azotemia A, sodium chloride B, parathyroid hormone C, aldosterone D, and angiotensin 2 E. Azotemia, sodium chloride, parathyroid hormone, aldosterone, angiotensin 2. I kind of like this question because I'm getting different options or answers, which means that, okay, you know, people are thinking independently. That's perfect. That's what I love. Okay, let's see. Somebody answered and said, wait, no. Hey, assuming you're Nigerian, die or no will be no to stretch. Don't follow others. So aldosterone retains salt. Yes, aldosterone retains salt. I agree. Okay, now let's answer the question. When your blood pressure drops, remember, when your blood pressure drops, I am stuck between the two. Okay, fine. Don't worry, you get the clear explanation now. When your blood pressure drops, right? We said that what happens is that the liver will produce angiotensinogen. The kidney will produce renin to convert that angiotensinogen towards angiotensin 1. Angiotensin 1 will be converted to angiotensin 2 by the what? By ACE from the lungs, right? What does angiotensin 2 do? Think about it. It does three things. One, it will go to the hypothalamus and make you sensitive to, like, make you feel like drinking water. So it just increase the blood pressure. I told you, when the blood pressure is low, it means that the fluid is low. So the body wants water to increase the pressure. So what angiotensin 2 does, three things. One is that it will do what? Make your brain to tell you to go and drink water. Test. That's one. Two, it will cause vasoconstriction. Does it make sense? It will cause vasoconstriction. Then the three, it will make the adrenal cortex to produce what? Aldosterone. Aldosterone will retain salt and water will follow salt. All these three things will increase fluid. And when the fluid increases in the blood, it will increase what? Pressure. Simple. Now look at this question. It says, in response to a drop in the overall blood pressure, that stimulates constriction, angiotensin 2, not aldosterone. Aldosterone is salt. Aldosterone will not do vasoconstriction. The two of them leads to the same thing, which is to increase blood pressure. But aldosterone will do what? Cause salt retention. Salt retention in the blood will lead to water entering the blood. When water enters the blood, it increases blood pressure. But angiotensin 2 is what causes aldosterone to do that. Then added to that, it will now cause what? Vasoconstriction, leading to increase in water and also lead to thirst. So that's the answer is angiotensin 2, E. So you can clap for yourself. Okay. Now let's look at this, please. Because I will soon stop. I will soon round up for this, and I'm not going to discuss glucose, please. Not glucose, digestive system. I'm not discussing it. I'll just start throwing in questions. I'll bombard you with questions. I'll bamboozle you until you have mastery of the entire thing. Okay. Now look at this question. I will call the option just once, please. So I need you to open your ear. All right. If you are sleeping, wake up. I don't know why I can smell it that somebody is sleeping. Wake up. Touch yourself. You say bamboozle us. Okay, look at this question. Glucose and amino acids are reabsorbed from the glomerular filtrate by the dash. Where does reabsorption happen? That's what this thing is asking you. Where does that reabsorption happen? Simple. A, renal corpuscle. B, PCT, that's proximal convoluted tubule. C, DCT, which is distal convoluted tubule. D, glomerular capillaries. E, collecting ducts. So we have renal corpuscle, PCT, DCT, glomerular capsule, and collecting ducts. Answer. Come on, let's go, guys. Let's go. Okay. You guys are very correct. The answer is PCT. You guys are extremely correct. I was thinking that this question is going to shake you people. It didn't even shake anybody. Why? Okay. Let's see. Sorry, I didn't discuss this, but it's extremely important. Yes, thank you guys. You guys are correct. It's PCT, all right? This question is extremely important for your clinicals, most especially. Hypocalcemia stimulates dash. Remember what hypocalcemia is? Hypocalcemia is what? When there is low calcium. When there is low calcium. So please, look at the option here. A decrease in aldosterone production. B, secretion of people don't even need options anymore. Interesting. Okay, I'll give you only two options, A and D. A decrease in aldosterone production, secretion of parathyroid hormone. Come on, guys. Let's go. Impressive. You guys are already impressing me with your answers. I love it. I am so loving it. Keep going. This is what things similar to this that you see in your exam. So don't shy away from answering, all right? Do you remember what I said about parathyroid hormone? You know, I said parathyroid hormone, PTH, is what? Phosphate trashing hormone. It pushes out phosphate to collect what? Calcium. So when calcium is low, you understand, parathyroid hormone is released, all right? So that it will what? Push out potassium to phosphate rather to take what? Calcium into the blood. All right? So the answer is secretion of parathyroid hormone. You can't forget this, so you can't. You cannot forget this. I think I'm coming to the end of this urinary because we have other things to do. And also, please stop looking for cough. I don't say someone said this question. This question is very hard. You're very funny. Any chance we could get our grades covered? It's too early. Aldosterone acts on the dash. Aldosterone acts on the distal convoluted tubule. Please, I'm giving you this as an information. Aldosterone acts on DCT. Somebody said just asking for a friend. Professor, can you put this question on the exam? We will see. We will see to that. What I need you to know is to see that there is no big deal about your exam. To see that the questions you are going to get are these questions, you know, exactly something similar to these questions. No biggie. Trust me. Like when you write your exam, you will understand what I'm telling you. The only thing I just try to do always to make sure that, okay, if you spend this night, we've spent almost 2 hours right now, and definitely we exceed that 2 hours because we've not even started digestive. I want it to be worth it for you. Do you understand? So, because after the exam tomorrow, I will ask you guys, do you want us to have this session again for another exam, or you don't want us to do it? Then whatever you decide, we'll proceed with it, all right? But you don't need to answer that question now until when you finish your exam. So, but what I need you guys to do is to be actively engaged. I know some of you are feeling sleepy. I'm so sorry. I'm also tired, all right? But let's be actively engaged. Let's make sure we overcome these two topics. I want to, if I'm satisfied, you understand, then we can proceed, all right? So aldosterone acts on distal convoluted tubule, that DCT. Perfect. Look at this question because this is what you'll be doing in the clinic. And please, in the clinic, if they ask you a question and you get the answer, if they ask you a question in the clinic, because they will ask you a lot of questions when you are in the clinic, if they ask you a question in the clinic and you get the answer, if they ask you who is your professor, tell them that it's me. But if they ask you a question and you don't get the answer, you fail the question. If they ask you who is your professor, tell them that you don't know, you cannot remember your professor for anatomy. Please. Thank you for the information. Look at this question. Oh, somebody asked a question, Professor, my midterm. Yes, please stick out with me, all right? Yeah, one thing you should know, you guys should know, is that it's something we call priority. You understand? Your lab exams are 30%, your lecture exams are 70%. So for me, it's a no-brainer that you need to make sure you conquer your lectures. All right. So which of the following is a direct result of antidiuretic hormone? A, decreased urine volume. B, decreased urine molarity. C, increased urine volume. D, increased urine salinity. E, increased urine acidity. Do I need to post it in the chat? No. I'll take the options again. Which of the following is the direct result of antidiuretic hormone? A, decreased urine volume. B, decreased urine molarity. C, increased urine volume. And D, increased urine salinity. E, increased urine acidity. Let's go, guys. Let's go. We have 40 people here. Let's go. I need us to finish up this thing and, Okay. Yeah. So that question was asking. Let me see the question again. I was actually looking out for other questions to see. Okay, that question was asking which of the following is a direct result of antidiuretic. Of course, antidiuretic hormone decreases urine volume. Simple. Remember, what is the function of antidiuretic hormone? We want to, somebody is dehydrated, somebody is losing blood volume, right? We want to stop that person from also losing more water. Simple. That's the function of antidiuretic hormone. Antidiuretic hormone will just go and make the collecting duct permeable to water, and the water, instead of going down the collecting duct as urine, it will be entering the blood back, thereby increasing the blood volume. Simple. So if it increases blood volume, it is decreasing urine volume. So the answer is A, decreased urine volume. So I'll give you just two more questions, and we will jump straight up into this thing. Just two questions, and that will be it. Just two questions. Look at this question, guys. This is one question, second to the last, that I need you to know. Oh, you say I'm frozen? Am I? Please, am I still frozen? I don't think so. Yeah, I was just still because I was looking for something I feel that you need to know. Okay. Yeah, it decreases urine volume. Like the fluid that's supposed to be going in the urine is collected back into the blood. Collected back into the blood because we need to retain water. All right. It does almost the same thing with aldosterone, but aldosterone does it in a different way. This one opens the aquaporin pumps, right, in the collecting duct to retain water. But aldosterone, what does it do? Aldosterone will retain salt, and water will just follow salt. So look at this question. The countercurrent multiplier recapture. This is the second to last question for urinary. The countercurrent multiplier recaptures dash and is based on fluid flowing in the dash direction in two adjacent tubules. Option 1, potassium, same. Let me post it. Option 1. Option 1A, rather. Then option B. Then option C. Then option D. Then option E. Okay. So those are the options. The countercurrent multiplier recaptures dash and is based on fluid flowing in the dash direction in two adjacent systems. Okay. Perfect. You guys are good. The answer is D. Sodium, opposite direction, right? Because the countercurrent multiplier is just salinity, all right? It's all about salinity. So sodium in the opposite direction. That's just the answer. Please put it in your head. Know it. Let me give you the last question before we jump to okay. This is the last question before we jump to normal urine from a healthy person should not contain dash. A, creatinine. B, urobilin. C, glucose. D, ammonia. E, magnesium. Normal urine from a healthy person should not contain A, creatinine, B, urobilin, C, glucose, D, ammonia, E, magnesium. Let the questions keep answers keep flowing. Let me see. Somebody said protein and blood. Protein and blood is not in the option. But I understand where your direction. Now, what you need to understand is that, you know, a little amount of protein sometimes is found in the urine, actually, right? Clinically, a little amount of protein is sometimes found in the urine. But what you need to know is that, you know, the appreciable amount of protein cannot be found in the urine because it's too heavy. It doesn't even filter. But something like glucose filters. Glucose passes in, it filters, it enters the urinary flow through filtration. But the only thing is that something like glucose is what? Reabsorbed in the PCT. That's what you need to know. It's reabsorbed in PCT. So the answer is glucose. But when there's a lot of glucose in somebody's blood, it will be filtered through the urine. But that condition is not physiological, it is what? Pathological. That's what we call diabetes mellitus. All right? So the answer is glucose. The answer is glucose. Please, for your information, what is the pigment responsible for the color of the urine? Somebody should put answer for me quickly. What is the pigment responsible? What is the pigment responsible for the color of the urine? Somebody say urochrome. Is that correct? Somebody say urochrome. Is that still correct? Okay. I have 4 urochrome. Somebody say sodium. No? Somebody say urochrome. Yes, the answer is urochrome. Please, the answer is urochrome. If you see this question in the exam, the answer is what? Urochrome. In case of if you see that kind of question, that's the pigment. And also, the minimum daily output of urine is what? What's the minimum daily output of urine, guys? Minimum. The minimum daily output of urine. The minimum. Okay, 1 liter, yeah, 1 to 2 liters. Now, to meet, if somebody now asks you, now, yeah, if somebody now asks to meet the definition of polyuria, the minimum daily output of urine is dash. You see that question? Very, 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 the question has a little dimension to it. Look at the question. I know I'm already done with my last question, but please, just bear with me and look at this question, please. Look at the question. They said to meet the definition of polyuria. Mind you, they said to meet the definition of polyuria, meaning that what are they talking about? They are talking about polyuria. They are talking about what? Polyuria. The minimum daily output of urine is dash for polyuria. A, 0.5, 1.0, 1.5, 2.0, 3.0. Answer. 0.5, 1.0, 1.5, 2.0, and 3.0. There's no 2.5. Okay, somebody said 2 liters, somebody said 3, somebody said 3.0, somebody said 2.5. Okay, keep going. 2.5 to 3. Please, the answer to that question is 2 liters. So we say, okay, the normal urine flow is 1 to 2, meaning that anything above what? 2. From 2 and above is polyuria. The answer is 2. Please. In case of if you see this kind of question in the exam, they are talking about polyuria and they say, what is the minimum for polyuria? The answer is 2.0, not 3.0, and not 0.5. Thank God I mentioned it. Thank God I don't know how I just thought about this question now. Thank God I mentioned it. Do you understand? And remember, the 3 P's for diabetes. 3 P's of diabetes is what and what and what? Somebody. You're welcome. The 3 P's of diabetes is what and what? Three P's of diabetes is polyuria, polydipsia, and what? Polyphagia. Yes, polyuria, polydipsia, and what? Polyphagia. Now, the final thing I'm going to talk about in urinary, the last but not the least that I'm talking about is, please, can somebody tell me, yeah, polyphagia, the person wants to eat too much, polyuria, you are urinating too much, polydipsia, you are so thirsty. Now, please, can somebody tell me, I need somebody to rescue me from this question, all right? Which 2 substances are most useful for determining a patient's glomerular filtration rates? I know I said I'm done. Yes, I'm actually done, all right? But please, this one is my last dunning this night for urinary. Which 2 substances are most useful for determining a patient's glomerular filtration rate? There are 2. So give me 2 options. Somebody mentioned creatinine, actually. Creatinine and what? Urea. GFR. No. Yes, somebody just got the answer. Maybe I should start giving gifts when people get this kind of answers. Okay, keep going. Let me see if somebody is very close to it again. But only one person has gotten it well. Okay, somebody? Yes, 2 people got it correctly. Yes. Yeah. So you guys know your stuff. I love it. It's inulin and creatinine. We don't use inulin, right? Why we don't use inulin is because inulin is invasive. You have to inject it into the patient. So instead, why do we need inulin? Not insulin, no, please. The option, let me give you the option. A, insulin and glucose. They will put insulin for there to confuse you. Don't pick insulin, no. Don't put it. We are not using insulin to check GFR. Please. We are not using insulin to check GFR. What we use is inulin and creatinine. The body makes creatinine, so it's natural. So you don't even need to inject creatinine into the patient. But the only thing that creatinine does not go out 100%. All right, but inulin goes out 100%. So ideally, inulin is the best to use. But because of it is invasive, we prefer creatinine. All right, so creatinine and inulin. All right, so that is that for urinary system. I believe that you guys are very confident now in urinary system. Anything they throw at you, you do it like this, and you are good to go. So if you have any question, you can ask. If you are good with urinary system, I want you to press the thumb up button if you've not pressed it. And that thumb up button is just 15, and we have more than 40 here. If you are good with urinary system, we move. Yes, keep pressing it, keep pressing it, keep pressing it, keep pressing it. So I'll throw you roughly 20 questions on digestive system, or a little more. You understand? So, but you'll be very fast with me, all right? I'm not reviewing it, sorry. I should have reviewed, but no, we don't have much time. I know you guys, we already spent 2 hours that I promised, and now it's extra time. And it's fine. If anybody want to sleep, it's fine. You can actually, go off. But for people that are here, let's move very fast. All right? Very, very fast. Okay, good. Thank you. Okay, good. Okay, perfect. Somebody is ready for digestive. Somebody is drawing me digestive structures. Okay, first question, giveaway. Oh, somebody wants. Sarah, thank you. The uptake of nutrient molecules into the body's own tissue is called what? Okay, guys, this is warm-up question. Warm up. Let's warm up. Warm-up question. Warm-up questions. Let's go. Yes, you guys are correct. It's absorption. Absorption. Uptake of nutrient molecules into the body's own tissue is absorption. All right. Remember, I told you something. I told you that the digestive system is like outside. All right. What am I talking about? The digestive tract is like outside. So if I throw a food in my mouth right now, and that food does not absorb into the body, right? It will just go out from my mouth to the esophagus, to the stomach, to the intestine, to the large intestine, to the anus, and it goes out of the anus. So it has to enter inside the body. How does it enter inside the body? Through absorption. All right. Now, I need you to look at this question because this question is a must whenever they give you any digestive question exam. Look at this question. Look at this question. The options. I'll give you the options. So please listen attentively so that I don't need to read it too many times. My mouth is hurting me. A, protein nucleotides. That's A. B, amino acids proteins. C, polysaccharide amino acids. D, nucleic acids nucleotides. E, fatty acids cholesterol. An example of chemical digestion is the breakdown of A, protein into nucleotides. B, amino acids into proteins. C, polysaccharides and amino acids. D, nucleic acid and nucleotides. E, fatty acids and cholesterol. You guys are very brilliant, too. I was thinking that this question is going to throw people off balance, but it didn't. It actually didn't. You guys are extremely correct. It's nucleic acid and nucleotides. It's nucleic acid and nucleotide. And remember, nucleotide is you see even there in your if you check the beginning, yeah, it's kind of confusing, of course. I know. If you check the beginning of your PowerPoint on digestive system, you see it. All right. It's nucleic acid and nucleotides. And nucleotides, remember, nucleotides is made up of three major things. What are they? Nucleotides is made up of three major things. Three major things. We have the phosphate group. We have the sugar. Yeah, phosphate, sugar, and nitrogenous base. But I'm not talking about genetics right now. So let's move. I promise you we'll be very fast, and that's exactly what I plan to do. Okay, this is a giveaway question just for warm up. This is a giveaway question. Yes. Don't worry. This is a giveaway question for warm up. Which of the following is the accessory organ of digestion? Which of the following is the accessory organ of digestion responsible for producing bile? Okay, this is for warm up. Everybody should answer this question. Oh, we've reduced to 31. Okay, people have run away. That's good. That's fine. That's fair. I've taken a lot of your time. Okay. Perfect liver. Okay, look at this question. I'm still warming up with you. Look at this question. The answer is liver, please. That question, the answer is liver. Look at this question. Which of the following is not an accessory organ of digestion? Let me give you the option because you need to know the option. Let me give you the option. Which of the following is not an accessory organ of digestion? We have the tongue. Let me see if I can put this thing. Okay, this is the options. We have the tongue, we have the liver, we have the pancreas, we have the salivary gland, and we have the spleen. Tongue, liver, pancreas, salivary gland, and spleen. Answer. Which is not an accessory. Let's go very fast, very fast. The faster we go, the better we finish up. Let's go, guys. Good, 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 good. Okay, yes, the answer is spleen. So spleen is the odd man out, all right? Accessory organs, we have the tongue, the liver, the pancreas, the salivary glands. And I told you something about accessory. Anything accessory is what? Assistant. It's not doing the main thing. Do you understand? But instead, it is what? Assisting in one way or the other, all right? Even you have the pancreas attached to it. Okay. Now, this is a question that will always come out in your exam for digestive system. Look at this question, guys. Look at this question. The layer that is responsible for the motility that propels food and residue through the digestive tract is called the dash. Remember something, if you watch my digestive video, right, I mentioned something about the digestive system not obeying the law of gravity, meaning that if I turn it upside down and put something in your mouth, it will still go. There is something that is controlling it. What is that layer? Option, lumen, muscularis externa, submucosa, mucosa, and serosa. Lumen, muscularis externa, submucosa, mucosa, and serosa. Keep going, keep going, keep going, keep going, keep going, keep going. My sister is very funny. She joined this live and she texted me now that my English is terrible. Please bear with the English and the accent. Oh? Please, anything you don't understand, please feel free to post it here. I'm just trying my best with this my Nigerian accent. Okay, so the answer is muscularis what externa. Please. The answer is muscularis what externa. The layer that is responsible for that motility that pushes food is muscularis what? Externa. Thank you. Not my heart. She's making fun of me. Okay. This is a question that I'm still warming you up, but we'll fall in properly now. The serous membrane that suspends the stomach and intestines from the abdominal wall is called the dash. A, please listen to the options so that I can go just once. Listen to the options. A, mesentery. B, mucosa. C, submucosa. D, muscularis mucosa. E, muscularis externa. Loretta, you're funny. Okay, thank you, Martins. Take care of yourself. Okay, yes, the answer is mesentery. The answer is mesentery. Quickly, look at this question. Yes, the answer is mesentery. I want to hurry up because a lot of people need to sleep. The outermost layer, that answer is mesentery, you're correct. The outermost layer of the digestive tract, which is composed of a thin layer of areolar tissue and simple squamous epithelium, is called the dash. Perfect. The answer is serosa. You're right. You guys are wonderful. So please, yes, the answer is yes. So now let's go to the for people that are still here. Now let's go to some proper questions. We are finished warming up. Yes, the answer is serosa. We are finished warming up. Let's go to the proper questions now. Look at this question. Each of the following lists some of the tissue layers of the digestive tract. Which one has them in correct order from lumen to external surface? I'm going to give you the options. Please. You see, in digestive system and in the in digestive system and in urinary system, they always give you arrows. They always ask you sequence. So pay attention. This is A. They love sequence so much. This is B. This is C. This is D. And this is E. So let's go. What's the sequence? What's the sequence, guys? What's the sequence? You guys are so smart, man. You guys are so smart. I'm impressed. I'm impressed. So, this kind of question, there's just this skill you need to answer this question. You know that the most outermost part, the outermost part is the serosa. So just go to the extreme. Anyone that is not serosa, remove it. Simple. So if you remove the B, C, D. So you are left with A and B. Then you choose. It becomes easier for you. It becomes easier for you. All right. So the answer is lamina propria, which is a type of connective tissue. All right. Remember, the connective tissue is coming immediately after the epithelium of the digestive system. What is the epithelium of the digestive system? You did it in anatomy 1. That's the columna, right? Depends on which part anyway. That's the columna. Simple columna. So, and the epithelium is not vascularized. So it always have what? The vascularized connective tissue under it. And that connective tissue is lamina propria. So that's why we have lamina propria. After that, we have the muscularis mucosa, submucosa, muscularis externa, and what? Serosa. It's very important that you guys know this sequence. Thank you. Like, everybody got it seamlessly. I was even waiting to smile that you guys got the answer wrong. Okay. Let's see. Look at this question. These questions are too large. I really don't like these big, large questions. Okay, look at these, guys. The dash regulates digestive tract motility, secretion, and blood flow. Its neurons are found in the options. Sometimes I wish I discussed this digestive system before we even start doing these questions, but it's okay. This is A. This is B. Incoming. This is B. This is C. This is D. And this is E. So let's go. The dash regulates digestive tract motility. What regulates digestive tract motility? Secretion and blood flow. Its neurons are found in the keep going. Yes, all of you are very correct. It's enteric, the enteric plexus, right? The enteric inside it has a plexus, the albax, and the second plexus, that's mediastinal plexus. They are enteric plexuses that regulates digestive tract motility, secretion, and blood flow, right? And they are usually found in the submucosa, that's submucosa plexus, and also the one that's found in the muscularis externa. Extremely important that you know these things. You understand? So it's now look at this. They will ask you, did I say they will? Yes, it's they will. Look at this question. No. Look at this question. Yes, of course, you're correct. To propel food, push food. So look at this question, guys. Look at this question, guys. Option A, lingual and labial. Don't worry, let me put it in. This is A. Option B, submandibular and lingual. It's getting a little complicated, I know. Please, don't slip off on me, please. Option C, I need you guys to be well prepared. Sublingual and parotid. Then option E, okay, pick your answer, please. The dash gland is an extrinsic salivary gland, whereas the dash gland is an intrinsic salivary gland. Which one is extrinsic? Which one is intrinsic? It's fine. It's fine if you don't have an idea. We'll look at it. Okay, so good. The answer is B. Yeah, it's B. Somebody said BC. No, the answer is B. Look at it. The answer is B. Submandibular. The dash gland is extrinsic. Extrinsic is outside the tongue. Do you understand? So we have the submandibular, sublingual, the parotid. All these things are extrinsic salivary gland. So they said the dash gland is an extrinsic salivary gland. Number one, lingual is intrinsic. So A is out. Number two, sublingual, okay. Number C, sublingual, okay. Number submandibular, okay. D, sublingual, okay. E, lingual is out. So we have B, C, D. All right. Now you go to the other side. They are asking about intrinsic. Lingual is intrinsic. Sublingual is extrinsic. Parotid is extrinsic. So the answer automatically becomes what? B. That's sublingual, submandibular, and lingual. All right. He said last one, lingual and sub. No. Lingual is intrinsic. And the first option is asking you about extrinsic. First option is asking you about S3. So whenever you are picking this question, first of all, forget, for me, what I usually do in the exam is I forget the second blank, right? I focus on the first blank. If I get the answer on the first blank, I will check the options. Which one has that my answer? For example, here they say extrinsic. I know that submandibular is extrinsic, parotid is extrinsic, sublingual is extrinsic. I remove everyone that has intrinsic in the first space. So that's why I eliminated, they call it intelligent elimination. I eliminated A and E. So I have 3 other options to choose from. It reduces my chances of failing that question. Then you go to the other part, they're asking intrinsic. Which one is not intrinsic? Sublingual is not intrinsic, you remove it, C. Parotid is not intrinsic, you remove D. That's how we got the B, all right? I hope it's clear. I believe it's clear to you guys. I am sure it's clear to you guys. I'm looking for, yes, this question always comes out because it's clinical. It always comes out because it's clinical. Even in your final exam, you see a question like this. Acid reflux into the esophagus, that's heartburn, is normally prevented by what? What prevents acid reflux? A, pharyngeal constrictors. B, upper esophageal sphincter. Hold on. Upper esophageal sphincter. C. Hold on, so that you pick from the options. C, lower esophageal sphincter. E. D, rather. Let me just give you this D instead of that other option. Then this D. Okay, people are already answering. Let me see what you're saying. So you're saying sphincter. We have 3 sphincters there. We have the upper esophageal sphincter, we have lower esophageal sphincter, we have pharyngeal and buccal sphincters. Which one? Somebody say above the stomach. Okay, you're talking about the lower esophageal sphincter, I believe. That's the LES. Perfect. You guys are absolutely correct. All right. The answer is lower esophageal sphincter. All right, because it prevents food from regurgitating or refluxing from the stomach up to the esophagus. And the truth of the matter is that one of the reasons why this thing is extremely important is because if you keep allowing food to reflux from the stomach is very acidic. It will keep eroding the esophagus, right? Before you know it, it leads to what something we call metaplasia. Metaplasia is changing of one epithelium to another epithelium. Physiologically, one place that metaplasia usually happens is in the vagina, because the vagina is a simple cuboid, right? Now, for that as children, but by getting to puberty, it changes, it hardens up to what stratified squamous, non-keratinized. That's what we call physiological metaplasia. We also have pathological metaplasia. Pathological metaplasia is usually happens to smokers. You know the epithelium of the trachea, that's the respiratory tract. It's what? Pseudostratified epithelium. It has goblet cell, which produces mucus. So if something enters your nose, the mucus traps it. You don't even know. You don't need to cough. You understand? But if that thing passes the mucus, you start coughing. That's second line defense. Now, for smokers, for chronic smokers, what happens to their epithelium? What happens to the epithelium of their trachea? It changes from pseudostratified to what? To stratified squamous. Pseudostratified to stratified squamous. And stratified squamous, yeah, good night. Stratified squamous does not have goblet cells. So if dust particles enters inside, nothing to trap it, the person starts coughing. That's why chronic smokers cough a lot, because they were already undergone pathological metaplasia. So metaplasia is changing. So to avoid, that's why GER, the GERD, is very, very dangerous, because it can cause metaplasia, and that metaplasia can become cancerous, can lead to neoplasia with time. All right. Okay, so I'm just giving a rundown of that so that you will have in mind of what we are talking about. So look at this question. I need you to give me a straightforward answer for this question, because it's very important. Once changed, there is no regeneration of the goblet. No. Once metaplasia happens, it doesn't go back. That's what you need to know. You understand? It doesn't regenerate back. You understand? And goblet cells is only found in columnars and in usually some columnar and pseudostratified columnar. Some simple columnar and pseudostratified columnar, right? And we know you can hardly see stratified columnar. We hardly see it in human anatomy. So that's why the only thing we always talk about is simple columnar that's found in the GI, and also the pseudostratified columnar that's found in the respiratory tract. All right. So once that goblet cell is changed, it's difficult for it to come back. And that change always leads to cancer. Honestly, that metaplasia always leads to cancer, pathological metaplasias. That's why chronic smokers, once it transforms, you see them start coughing so much, they have high chances of having lung cancer. All right? Okay, I believe that's clear. Look at this. Look at this question. Guys, we will soon come to the end, all right? I just want to satisfy myself that, you guys are already well equipped. Infants have how many deciduous teeth, whereas adults have up to how many permanent teeth? I'm not giving options, so give me the answer. Let's go, guys. Let's go. Let's go, guys. Come on, guys. We're up to 25 here, so I need at least 10 people to give me that answer before I'm satisfied. Okay, now I'm seeing variable answers. Perfect. Perfect. Okay, yeah, you guys are wonderful. You guys are correct. It's 2032. Please, if you see it in the exam, please pick 2032. Don't mince words. 2032. 20 milk teeth, 32 permanent teeth. All right. Look at this question. Which of the following is correct? Is the correct list of tooth anatomy from the most superficial to the deepest? I'll give you options. I'll give you options. A, this. B, incoming missile. A, B, C, D, and E. Yes, it's 2032. You're correct. And E. So, which of the following is the correct list of tooth anatomy from the most superficial to the deepest? Answer. Let's go, guys. Let's go. Hit the button. Hit it, and type. Cement roots, canal, root canal, enamel, root canal, dentine, enamel, cement, enamel, dentine, pulp, crown, enamel, dentine. Okay, you guys are wonderful. The answer is D. It's enamel dentine pulp. Please go and look it up again so that you'll be clear. So that enamel dental pulp, EDP, enamel dental pulp. Yes, it's D, guys. It's D. I want to ask you 10 more questions and I'll leave you to go. All right? Just 10 more questions and I'll leave you to go. Because you guys have really tried. Honestly, you guys are doing well. With this spirit, I am very, very sure that your anatomy, your college anatomy and physiology, you will smash it. Oh, somebody said, why not what? He said, why not E? Because you put crown first now. Crown, enamel, dentine. You understand? Crown, enamel, dentine. But it's supposed to be enamel, dentine pulp. All right, just check it. Check the diagram so that you'll be able to get it clearly. All right. I don't want to project the diagram. If I project it, it may start lagging me again. So look at this question, guys. Carbohydrate digestion begins in the dash, whereas protein digestion begins where? Answer. Answer. Hit it, hit it, hit it. Hit it, everybody. You say enamel, then crown. Yeah, something like that, of course. Of course, but you always have to choose the right option when you look at the arrangement of the options, all right? So it's always enamel, dentine, and pulp, always, not crown. No, always enamel, dentine, and pulp. So please look at the diagram, please, so that you be very sure, because they can bring something similar to that. All right, but one thing I want to also tell you is that most times your answer should be based on your options. Your answer should be based on your options. Very, very important. Yes, the answer to that question is mouth and stomach. Carbohydrate digestion starts in the mouth, whereas protein digestion starts in the stomach. Yes. So I'm accelerating now. I'm accelerating. Where is the swallowing center? Very fast. Somebody should give me the answer. Where is swallowing center? Swallowing center is found where? Option: mouth, oropharynx, esophagus, medulla oblongata, enteric plexus. Answer quickly, quickly, quickly. Let's hit it. Quickly, quickly, quickly. Quickly, quickly, guys, quickly. Step on it, step on it, step on it. Swallowing center is located where? More people, more people, more people. Where? Medulla. Okay, yes, you're correct. Medulla. Now look at this question. Let's go very fast. Which one is voluntary? Which one is involuntary? Or are the two of them voluntary, or are the two of them involuntary? Let's move. The oral phase of swallowing, is it under voluntary or involuntary control? The pharyngeal and the esophageal phase. So somebody say vol involuntary. Let's see. No, it has to be two answers. Okay, somebody say voluntary, involuntary. Somebody voluntary, involuntary, voluntary, involuntary, voluntary, involuntary. Yes, you guys are absolutely wonderful, right? So your oral phase is voluntary. You are the one that will voluntarily put food in your mouth. It's as simple as that. But after that, you don't control what happens. All right. So others becomes what? Involuntary. I promised I would ask just 10 questions more, right? So I've asked 2. So this is the third one. Once it's up to 10, tell me, let's stop there. The dash of the small intestine is or are similar to the dash of the stomach. Options. I'll just give you 3 options instead of 5 to make it faster. This is A. This is B. This is C. Answer. A, B, C. The dash of the small intestine is or are similar to the dash of the stomach. Come on, come on, come on. We are more than 30 here. I need all of you to. Okay, let's go, let's go. I need everybody to answer. Yes, you are correct. The answer is C. Intestinal crypts is almost like the gastric pit. Try to look at the picture so that you'll be clear, all right? Look at this question. Yes, the answer is C. You're correct. Please look at this question very fast. I'm trying to hurry up, guys. So bear with me. Okay, somebody said I'm confident. Thank you. Thank you. I love that. I love that for you. All right, look at the options. I just gave you the question now. Look at the options. A, pay attention so that I'll get this answer straight up. B, C, seems we are reserving the best for the last. D, oh, people are already answering. I love this confidence. So, like you didn't even see the options and you're already answering. This is maximum confidence. Like your confidence is giving me joy. Then this is E. Like, why am I even bothering to paste all of them? Your confidence is giving me too much joy. You guys are perfect. It means that you were listening. So pepsinogen is produced by the chief cells and is activated by hydrochloric acid, and hydrochloric acid is produced by the parietal cells. You guys are 1 million, making me happy. Please, you need to know the function of the stomach also, right? The function of the stomach, majorly chemical and mechanical digestion. Just put that in your head. I don't want to ask that as a question. I don't want it to be one of my 10 questions, please. Now, I've asked 4 questions, right? So it remains 6 to go. 6 to go, guys. I know you want to sleep, but please, 6 to go. And it is the 6th best to go. 6th best to go. So talk to me. Talk to me, guys. Talk to me. What is the answer to this? Do you need option for this? Please tell me you don't need options for this. Please, if you are writing, you have to write 2 answers. I think I will not give you option. Let me see. Let me see. Let me see. It has to be 2 answers. Okay, keep going. Keep going. Keep going. And okay. It's fine. It's fine to forget sometimes. Now you'll be reminded. Okay, you guys are extremely correct. It's intrinsic factor produced by what? Parietal cells. All right. You guys are correct. All right. And HCl is also produced by parietal cells. You remember that, right? Secreted by parietal cells. So you should remember that. Okay. So I've asked 5. 5 to go. 5 to go. 5 to go. Okay, 5 to go. 5 to go. I want to give you the best for the last because I'm rewarding you for being still being awake by this time. So that's the reward. Okay. Which of the following enzymes functions at the lowest pH? Option A, salivary amylase, B, pancreatic amylase, C, pepsin, D, trypsin, and E, dipeptidase. Keep it flowing. Keep it flowing. Okay, you guys are correct. It's pepsin. Pepsin acts on the stomach. Stomach has very low pH, so it's a giveaway. And please remember HCl production is parietal cells. Please remember. Extremely important that you remember this. Okay, my number 6 question. So I have 4 now to go. Yeah, highest could be any of them. Do you understand? You understand? Highest could be any of them. Because from the options, others act on pH of a basic pH. You understand? Not specific, but basic pH. So basic pH can be any value for them. So if they're going to ask you highest, right? They will give you enzymes that act on the stomach and give you one that doesn't act on the stomach. So you automatically know that, okay, the one that doesn't act on the stomach is the highest. That's the idea of the question. All right? Yeah. Somebody's asking salivary amylase. So I'm trying to tell you that, like, the saliva is basic, all right? So sometimes it's neutral. Do you understand? But the intestine, for example, is basic, and basic is pH above 7. I don't know if it makes sense to you. pH above 7. So if you look at that option, all the others does not act on acidic medium. So anyone that acts on acidic medium should be the lowest. But when they're asking you about the highest, they will not give you 2 enzymes that act on basic medium. I don't know if it makes sense to you. So because they don't have the exact pH that they work on. It's just they work on extreme low pH. Like pepsin can work on pH of 1, can work on pH of 2, can work on pH of 3. Those are low pH. Yeah. Okay, perfect. Thank you so much. Okay. So look at this. I have 4 questions to go now. I have 4 questions to go. Yeah. So which of the following is not a function of the gastric HCl? Option A. A. 1. Okay, this is A. This is B. I'm giving you 5 options here. This is B. This is C. This is D. And the final one is a little complicated. Okay, so what's the answer? Which of the following is not a function of the gastric HCl? So you need to know what are the functions of gastric HCl for you to know which one is not. All right? Yes. You guys are extremely correct. Somebody say, you guys are extremely correct. It doesn't emulsify lipids, all right? That's for the bile. Okay. I have, is it 3 questions to go, right? Look at this. What are the 3 phases of the gastric secretion? 3 phases of gastric secretion. I'll give you just 3 options. This is A. This is B. I know you cannot wait to run away, but that's fine. This is C. Okay, give me an answer. I'll just 3 options. What are the 3 phases of gastric secretion? Gastric secretion. What are the 3 phases? Keep going. We have up to 30 people here, so I need a lot of answers. Keep going, guys. Keep going. Keep going. Keep going. Why do I keep forgetting that the camera is here? You guys are so correct. It is cephalic phase. You understand? When you are thinking about food, your tummy will be doing gurum, 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 gurum. Somebody's writing the answer so that it will look big, so that will move. So cephalic phase, you are thinking about it, your tummy is moving gurum, gurum. Gastric phase is when it hits the stomach, and intestinal phase is when it gets to the intestine. Extremely important. You understand? So the answer is B, cephalic, gastric, and intestinal. Okay. Okay, so I have 2 questions to go, right? Okay, fine. What was the answer to this? I'll give you the options. I'll give you only 4 options. I don't want to give you 5. I don't want to overwhelm you guys. This is A. This is B. This is C. This is D. Okay, so the enterogastric reflex serves to dash. Answer. Keep going. I want to see more answers. Now, I know somebody will get right the other. Okay, yes, you are correct. The enterogastric reflexes helps to inhibit gastric motility when there is she has started gastric motility when there is chine in the small intestine. It stops gastric motility. All right, because when you put too much food, the small intestine helps to absorb. It's for absorption. So he wants it to she's still writing D. So he wants it to move slowly. Want it to move slowly, all right? So because of that, it will stop it from pouring in too fast. That's one. So that there'll be absorption. That's one. Secondly, if he pours in too fast into the intestine, it will burn up the intestine. Because the intestine is basic, the stomach is acidic. So that's why it's coming up, gradual, in squirts. That's how it comes up. Just gradual. So the last one, the last question. Let me see who is the first person to attempt this question. Hey, this is the option. Please hold on. Don't type. Let me put in the options for you. This is question. A hepatic triad consists of what? A. B. Somebody said I look too happy. I'm always happy now. Have you ever seen me looking sad before? Nah. Life is too short to be angry. So C. And also, I'm so happy because you guys are really getting the answer. It makes the work less stressful for me. Because now that you guys are getting the answer, I don't need to start explaining too much because it means that you guys are really following up and it means that you guys will definitely do so well in your exam. All right. So that's why I'm not. So that's the options A to D. A hepatic triad consists of what? Let me see. You guys are so correct. The answer is D. All right. The answer is D. Hepatic triads includes the bile duct, branch of hepatic artery, and a branch of the hepatic portal vein. Please, the answer is what? D. All right. So thank you guys very much. Just before you rush off, because I know some people are already wanting to jump to the bed. Before you rush off, please, the liver is what stores excess glucose. Remember, you eat, the food breaks down to glucose, it enters the bloodstream, the liver stores excess glucose in form of what? Glycogen. And what helps the liver, what makes that conversion? Insulin. Insulin mops excess glucose and converts it to glycogen in the liver. So if they ask you, what stores excess glucose? It's what? liver. Excess glucose, liver. Excess glucose, liver. All right? Very, very important for you to know this, what I just said now. And also, they can ask you what synthesizes the bile acid. That is liver. What metabolizes cholesterol? Liver. So liver metabolizes cholesterol and use it to synthesize what? Bile acids. Very important. You need to know a lot about the liver. Like, liver is very, very, very important. And what else do I need to inform you about? Pancreatic enzymes, they are usually secreted in response to CCK. People always mistake it for maybe insulin or glucagon. No, it's CCK. CCK is cholecystokinin. That is what pancreatic enzymes are secreted in response to this CCK. So immediately, food that contains food enters the intestine. Hold on. So immediately the food enters the intestine, CCK is produced, all right? It's initiated to tell the pancreatic enzymes to come out, all right? Extremely important that you know this, CCK, pancreatic enzyme, CCK. Now, there's a question that they usually ask. The sodium bicarbonate solution is secreted in response to what? Secretin, not CCK. So pancreatic juices come out in response to CCK. But sodium bicarbonate, which helps to dilute the acid that is coming from the stomach, is produced in response to what? Secretin. You need to know the difference between secretin and CCK. Pancreatic juices, response to CCK. Sodium bicarbonate, in response to what? Secretin. I'm repeating these things a lot because they are very important. No, I'm not pasting. I already I already said that I'm done with the questions. I'm just trying to tell you things that you need to put in your head. All right? Put in your head. And that should be it. Is there something I'm forgetting? Is there something I'm forgetting? No. And also, anyway, this one is a giveaway now. The three most abundant classes of nutrients is fat, protein, and carbohydrate. You understand? This one, you don't even need anybody to tell you this one for you to get it. You understand? And which of the following nutrients must be digested in order to be absorbed? You understand? They gave water, vitamins, proteins, minerals, and cholesterol. The answer is proteins. But water does not need to be digested. Vitamins does not need to be digested. Minerals does not need to be digested. Even cholesterol does not need to be digested. The only thing that needs to be digested is what's protein. You understand? This question is extremely important because it always comes out as number one question, self. Okay. So that should be it. Yes, secretin is I mentioned that the small intestine produces a lot of mucus, all right? A lot of mucus. You get? So that mucus secretion, all right, is produced as a response to secretin. That's what I was trying to tell you that time. It's produced as a response to what? Secretin. You get? But for CCK is pancreatic enzymes. All right. So it's just like me saying, I want you to come. So, how do I explain this thing now? When food enters the small intestine, right, from the stomach, the stomach is made up of acid, right? So immediately that stomach acid enters the intestine. The intestine will be like, oh, if I allow this acid to be more in the stomach, in the intestine, it will burn me up. So what do I do? Immediately it enters the intestine. It's the intestine will start calling sodium bicarbonate to be produced. Do you understand? So for sodium bicarbonate to be produced, there has to be something that will initiate that sodium bicarbonate production. And that thing that has to initiate it is what we call secretin. Do you get? So secretin initiates sodium bicarbonate production. Do you understand? Why CCK initiates pancreatic enzymes production? It's as simple as that. They are just like key. Do you understand? So just know CCK, no secretin, and you'll be good to go. Those are the two major things they ask. CCK for pancreatic enzymes, secretin for sodium bicarbonate. All right. Okay. Let me not stress on it. I think that should be it, guys. That should be it. Thank you so much. Thank you so much, and I really appreciate you guys. I wish you success in your exams. And if you have any question, please drop the question. Yeah, you can drop the questions for me, and you can always come back on the channel to look at this discussion if you need it. All right, maybe before your exam and everything, you just come back and look at it. All right. So after your exam, when you finish writing your exam this week, we can now discuss if this helped us or not. All right, so that we can know when to repeat it if we must. All right. So thank you guys very much. For people that are not subscribed, please try to subscribe. Okay. Good night. Hey, somebody said you should call her. Good night. So thank you guys. Have a nice night. I appreciate you guys. Take care of yourself. Yeah, take care, take care, take care. And don't forget to subscribe. Also, you can send the link. Yeah, good night to your other classmates that are not here. All right. People that are not here till we finished, tell them to come up to the channel. They will be able to see the video on the stream. Yeah. I appreciate you guys. Thank you for turning up. I wish you success in your exam. Yeah. Say like, comment, subscribe. Please like, comment, and subscribe, oh, so that this channel will, continue to bring out the good stuffs. Also, tell your friends, tell them that they come here, they see a lot of videos. So I'm going to make more. All right. Even the nervous system, I'm going to make nervous system video this weekend. All right. So that you will not have any problem for your exams. All right. Thank you so much. Thank you, thank you, thank you, thank you. So once again, I appreciate you guys, and I will be turning off now because I need to sleep. Today I had a long day. I just came back this night and jumped into the channel to, have this wonderful discussion with you guys. Thank you for liking as well. All right. Have a nice day, guys. Have a nice day. Good night. I'm turning off the stream now.